Doctor, we hear all sorts of things about bioidentical hormones. First of
Yes.
all, most people have absolutely no idea what they are. Secondarily, some people think that they're kind of mystery. And other people say they've changed my life and the life of my patients. Please
Right.
explain what bioidentical hormones are and what we could expect, what a woman could expect from them.
That's a great question, Lyle, because I do get that question all the time. So the big question is, what is this bioidentical hormone? What it is, it's a hormone that is biologically identical to what we produce in our own bodies naturally. So essentially, to give you a very precise explanation, we have certain receptors in our bodies that recognize a specific molecular structure, if you will. And that molecular structure has to be very precise for it to be utilized by our bodies. So as we age, those hormones start declining because all our organs and our glands start aging and declining in function. So if you give a woman a hormone that is synthetic, which is not the exact molecular structure that their body is used to recognizing, our bodies won't recognize it. As an example, if you take Premarin, when a woman takes Premarin, Premarin comes from a pregnant mare's urine. I think a lot of people know that now. A pregnant mare has 99 types of estrogens. Women have 3 different types of estrogens: estriol, estradiol, and estrone. Those are the only receptors we have. So when I take a pill of Premarin, my body is in shock. It doesn't know what to do with it. It doesn't recognize it. So the metabolites keep going around and around in our bodies, and it goes and does the side effect profiles that we see as far as whether it's heart disease or stroke or breast cancer, etc., because it doesn't recognize it. These are metabolites that just go around in our bodies. As compared to that, bioidentical hormones are the exact molecular structure. So we recognize it, we know what to do with it, and we are able to utilize it in its best way to do the function that it's supposed to do. So when we take bioidentical estrogen, we use 2 or 3 different types of estrogens. Usually in my practice, I use estradiol and estriol, a combination of those 2. We use progesterone. Progesterone, what you do with the progesterone is amazing. Progesterone is what's going to help you alleviate the anxiety, the panic attacks, the depression, the insomnia. All of those issues will be improved by progesterone. So most of the women that come into my practice, what they're dealing with is the same long laundry list of symptoms that every woman that I see, when they hit their mid-30s to early 40s, they're going through this, whether it's fatigue, irritability, mood swings, depression, low sex drive, weight gain, hair loss, brittle nails, constipation. All of these symptoms with hot flashes, night sweats, vaginal dryness, all of these symptoms are redundant, and we keep experiencing them until we do something about it. What is that something? That something is replace the hormones that our bodies are screaming for. We need those hormones in our bodies for all of the aspects of our bodies to function properly. We need to look at the thyroid hormone, which is a huge misconception in the medical society, where if you fall within this very broad range, all of a sudden you're told that your thyroid is within normal limits. It's not within optimal range. So essentially, when you're younger, you could have a lot of thyroid hormone, still be in that very wide range, and when we get 20 years later than that, we're in a very, very low range. It's still in the range, but we're not optimal. We cannot do the functions that we were doing before. So thus, we have the fatigue and the weight gain and all of those issues. So I really like to look at my patients, look at their hormone levels, look at their symptoms, look at what they're going through in their lives, and look at the combination of what each individual needs. And that could be a combination of bioidentical estrogen, progesterone, testosterone, DHEA, thyroid, sometimes cortisol, melatonin. All these are amazingly important hormones that need to stay in balance for proper function.
That's really something. How often do you find that you're working with a woman like this motivates her or her partner to investigate the male side of this same kind of situation?
That's a great question, because that's how, in fact, I get most of the main males in my practice. The entire community where I practice knows that I'm a board-certified OB-GYN. What man is going to want to come to an OB-GYN for their wellness? But I have a large percentage of my practice has become well, a large percentage of my patients is now males because they are also going through andropause. So when you look at your wife and they are energetic and all of a sudden their sex drive is great and they're feeling great, they're not tired anymore, they're sleeping well, they're happy, and the men are going, wait a minute, I think I'm missing the boat here. I want to feel that as well. And when they come in, we start talking about andropause. And it's such a shame that in the media we hear so much talk about perimenopause and menopause and women's hormones. But unfortunately, the media is not focusing enough attention on men. And men too are going through low libido, low energy, low vitality, not as much excitement for life, not as much muscle mass, not as much regards to working out and stress and not sleeping well, and nobody's talking about that. And I think we really need to address that because men too need that vitality, and it can be totally looked at and totally reversed by using bioidentical testosterone, the right nutritional supplements, as well as in some cases DHEA, melatonin, thyroid, cortisol, and other things.
So that means there are a lot of women that are going to be able to avoid a situation of being a caretaker for 15 or 20 years.
That's
once
correct.
they get. I think that's very important.
That is very important because as we know, we're all aging, but that doesn't mean we all need to get old. We're just aging chronologically. We can still stay vital and stay healthy and stay alive and stay very contributing members of society where we can stay very active, healthy, and happy. And that's the important thing because we need to keep ourselves out of the nursing homes and out of being burdens to the society. We want to keep ourselves being active, contributing members of society, and this is the way to do it. That's starting now, taking care of yourself, using the right hormones, the right nutritional supplements, living the right lifestyle with exercise, healthy eating, stress management, sleeping, etc., and really putting it all together and taking care of yourself, putting yourself first. Yes, give to others, give to your families, give to your friends, give to your elders, give to your children, but if you don't have enough energy to even get out of bed in the morning, you will not be able to give to anybody.
Thank you.
Absolutely.